Hi, good evening, and welcome to the webinar this evening. My name is Lloyd Philpott. I'm the Programme Director for the Postgraduate Diploma in Public Health Nursing. This evening, I'm joined by Michelle O'Regan, who is a practicing registered public health nurse, and she'll be talking to you this evening about her role as a PHN and her experience on the programme. And you can see off camera, I'm also joined here in the studio at UCC by Dr. Helen Mulcahy, who also teaches on the public health nursing programme. And she will be looking after the chat box where you can put all the questions that you have for me. And I will have a Q&A session at the end, and Helen will deliver the questions and I will answer them. We're also joined online by Katrina Kennedy, who is a current PHN student. Unfortunately, due to the adverse weather conditions, Katrina couldn't be with us in person, so she's joining us online, and you're very welcome, Katrina. And I welcome you.
Thanks, everyone.
Hello, Katrina. And I welcome everybody to the webinar. So the purpose of the webinar this evening is to provide you information regarding the postgrad diploma in public health nursing at University College Cork. I'll be starting off by looking at the entry requirements, and we'll run through that. I'll be looking at the different components of the PHN program that are delivered each year here at UCC. I'll briefly touch on the application process. I will look at the role of the PHN, and I'll be linking you with Michelle in relation to that. And then at the end, I will answer any questions that you may have, which you can put, as I said earlier, in the chat box. So I'm going to start off by looking at the entry requirements, because this is something that tends to get asked a lot when I get emails and queries from people about the program. So in order to be able to apply for the program, you need to be a registered general nurse on the NMBI register or entitled to be so. And you need 2 years post-registration experience. You can also apply for the program if you're a registered general nurse and in any other of the divisions outlined there on the slide, either as a midwife, a children's nurse, an intellectual disability nurse, a psychiatric nurse. And if you have won those qualifications and you're registered, you need 1 year's general experience, 12 months, and you need 1 year within that speciality. So that's the criteria in terms of the clinical experience for applying for the program. In terms of the academic qualifications, you need to have a level 8 qualification, an honours degree, level 8, or a higher diploma, postgrad diploma, a master's, which is level 9. I've put up here on the slide for you a academic transcript and a parchment cert, because as part of the application process, you will have to include in your application an academic transcript. And from previous years, we know that applicants tend to put in their parchment cert and not their academic transcript. So if you are applying for the PHN program through the HSC, you will have to include an academic transcript, and you can get the academic transcript. If you don't have a copy of your transcript, you can get one from the university where you completed the program. If you contact the student records and exams, they'll be able to forward you an academic transcript. So it's an academic transcript, not a parchment cert. Now, not everybody would have a level 8 qualification. You might have trained as a nurse, and you might have trained in the old way, and you might have a cert, or you might also have a diploma. If you don't have a level 8 qualification, you can still apply for the program. In order to apply for the program without a level 8 qualification, you need to complete an APEL, which is an accreditation of prior experiential learning. That is available to you on the HSC pack, which I will be guiding you to at the end of the presentation. You can fill that out if you do not have a level qualification, but also if you are unable to obtain your academic transcript, or if you're unsure whether your qualification is level 8 or above. If you're not sure and you're in doubt, you can also complete a APEL as part of the application process. I would strongly advise anybody who doesn't have an academic transcript to complete the APEL when submitting their application. That way you're ensuring that you have put forward at least one element in terms of the academic qualifications. There's also an English language requirement for those whose first language or language of primary expression is not English. And for those who in that category, you need to put forward evidence that you have the required standard of English, which we look at here, and it's an IELTS or an equivalent, and the test has to be within the last 2 years. And the minimum overall score required on the IELTS is 7. However, there are circumstances where that if you have undertaken an academic program, level 8 or above, or if you have worked in a country where the primary language expression is English for more than 2 years, you can submit your IELTS if it's more than 2 years, and that will still be accepted. So if you're working in the country, if you've studied in a country where the language of primary expression is English, and your IELTS has expired, we accept the old IELTS, but all applicants whose primary language of expression is not English must submit their IELTS or the equivalent test. There are 3 HEIs that deliver the postgrad diploma in public health nursing. There's University College Dublin, there's University College Cork, and there's the University of Galway. And you can see that there's 70 places in Dublin, there's 45 places in Cork, and there's 35 places in Galway. The postgrad diploma is a full-time 1-year program. The program runs from September through to June. The program includes academic modules and clinical placements. In order to qualify and register as a public health nurse, you've got to successfully undertake the modules that lead to 60 ECTs. Within the program here at UCC, we have a blended learning, which includes in-person classes, workshops, online learning, self-directed study, and clinical placement. The commitment to the program is approximately 37.5 hours per week. However, it's important to realise that there will be additional study regarding looking and preparing and delivering and submitting assignments for the program. As well as the academic component, there's also a clinical component. For the clinical aspect of the program, you will be allocated a PHN preceptor in a location, an area, and you will have a minimum of 675 hours with your PHN preceptor. That works out at approximately 18 weeks per year. And that's broken up into 4 different blocks. You don't do the 675 hours in one block. It's broken up. You do a clinical, you come in, you do a theory block with us, you go out, you do a clinical placement, theory block, clinical placement, etc. There's also an additional placement that takes place during the program, and that is a maternity placement, which is a minimum of 180 hours, which works out at approximately 5 weeks at a maternity hospital. This placement is for those who apply who are not registered midwives. If you're a registered midwife, you can apply for the program, you undertake the program, but you don't complete the maternity placement. If you apply for the program and you're not a registered midwife, in order to register with NMBI, you need to undertake the maternity module and the maternity placement. So to look at some of the modules that we have on the program, it's a really interesting program. The role of the PHN covers the cradle to the grave. So we look at from birth to death. We start off, we have a maternal, infant and family health module, really interesting. We look at the postnatal period. We look at the health of the mother, the infant and the family. We move on there and we look at child health, which would be looking at the child as they develop up to school going age. So that's approximately from the early postnatal period right through up until school going age. We also have a research module where you learn the methods of research, which again helps you greatly in your role as an evidence-based practitioner when you're working as a public health nurse. We also look at professional issues around public health nursing. We look at health promotion. We look at adults, older adults in the community. We also look at areas of social science, because there's a real social component to the role of the PHN as you're out there working in the community. And there's also the clinical placement module. In order to pass the program, you need to pass all those modules. We have a wide range of educators on the program. We have PHN academics. We have midwives who are lecturing on the program, covering the maternal, child and family health module. We have public health nurses who come in. We have advanced nurse practitioners, clinical nurse specialists, researchers. We also get in speakers from the services out in the community. So the support services, social workers, allied health professionals, and we also have services users who come in and who talk about their experiences, their lived experiences as a carer or living with disease, and they talk about their role, and engagement with the public health nurse. This is feedback that was received by one of the students from the PHN program 23-24. Again, I won't go through this, but you can read it yourself. But you can see how this student is talking about the support that they received in relation to their learning needs. And they also talk about meeting other nurses, various backgrounds, who brought knowledge and experience to the groups. And we would see every year the friendships that are developed along the way are invaluable. The peer support is incredible, and it's really nice to see some of these feedback where they talk about, friendships that will last a lifetime. So the program is challenging, but it is also extremely rewarding. In relation to applying for the program, there's a link that will be made available to you. It's the HSE website. You apply for the program through the HSE. If you go onto the HSE, put in Student Public Health Nurse Sponsorship Program, it should lead you to the page where you get information about the application process. And you also get the documentation that you need to fill out in order to complete the program or to apply for the program. The closing date for the program is at 12 o'clock on Thursday, the 16th of January. So again, time is a little bit tight for you if you haven't applied thus far, but there is time to get your documentation ready to fill out the application form and to have it completed by the 16th of January. Any application that comes in after 12 noon on Thursday, the 16th of January, unfortunately won't be put forward. Okay. So if you have any queries about the PHN sponsorship program in general, it's recruitment.phnsponsorship@hsc.ie. And if you have any questions about the PHN program after this evening, specifically regarding the program at UCC, you can contact me, Lloyd Philpott, at ucc.ie. The additional documentation in relation to the APEL and the transcript, that needs to be submitted with your application form. When you apply for the program, and if you're successful, you will be allocated a sponsorship area. We have sponsorship areas all over the country, and the allocation of sponsorship places, the first criterion is the order of merit on the interview panel. If your application is successful, you will be invited for an interview. If you pass the screening phase of if you have the necessary clinical experience, if you have the necessary academic qualifications, you will be invited for an interview. If you're successful at the interview, you will be put on a panel, and depending on if the panel is ordered according to the score that you obtained during the interview, and the first criterion in relation to allocation of sponsored places is the order on the panel. If you're first on the panel, you will get the first opportunity of all the applicants to go to the area that you choose. Generally, as you will see from the application with the HSC, you will apply for 3 areas. If you're successful, you will be, and if there's a place available in that area, you will be allocated that area. If there's no place in that area, or it has been, or the places have been filled, then you will be offered your second and third area. So in light of the fact that the interview is so important, I would highly recommend that you prepare well for the interview prior to undertaking the interview. So again, the second criteria is related to the sponsorship places, that if there is a sponsorship place in your area and how many sponsorship places are available. And the third criterion is the choice of your HEI. You will be asked to put a preference for your HEI, UCC, UCD, or Galway. And again, it will depend on whether places are available there or not. If you're successful, you'll be offered your highest preference placement. And it's important to say there is no option to defer. If you are successful, you need to take the place for the coming academic year. We don't defer places. It's not possible. Okay, I'm going to briefly just go through the PHN role, because I'm going to ask Michelle to give us a little bit more detail. So in general, the PHN is a generalist nurse in the community. The services are underpinned by the principles of public health and primary health care. The PHN manages a caseload within a defined geographical area. Services are delivered in a wide range of settings. It's a very, very interesting job. You could be in somebody's home, you could be in a primary healthcare centre, you could be in a school. There are a variety of settings that you can undertake your work in out in the community. And you work in collaboration with members of the primary care team. And you work also you collaborate with the acute settings, acute services, voluntary bodies as well. There's some relevant websites there. There's the homepage for the program at UCC, and that will give you details. And there's also the HSC website that looks at that will give you information about applying for the program through the HSC. You apply for the program through the HSC. So that's the delivery of the PowerPoint presentation. So what I will do now is I'm going to have a bit of a chat with Michelle and Katrina, just to give you a flavour of what it is like to be a current student and a past student. So I've prepared some questions. So Katrina, I might start with you if that's okay.
Yeah, no problem.
Lovely, and thank you again for joining us. So can you just, Katrina, just give me a little bit of background in terms of your nursing career to date?
Right, so I'm a general nurse and I'm a midwife. Trained in Waterford back in the way, the old certified way, and I went on and did the degree when I came to the Bachelor of Science Honours degree in MTU when I came to Tralee. And I worked as a midwife in UHK, been midwife manager in University Hospital Kerry for over 20 years. I decided I needed a change about 2 years ago, so I joined the community in Tralee as a community nurse, but I felt I missed the all mums and babies side of the work. So that's what enticed me to embark on the public health nursing course. I felt I had more to offer than just the care of the elderly, like you said, the cradle to the grave, but I missed the cradle a bit. So I felt I had more to offer the mums and babies side of the child development, which I am absolutely hugely loving as part of the course. And that's me to date and I'm embarking on this course.
And that leads me nicely into the next question. Just so your reason for applying for the program. So
it's because I suppose as a community nurse, we all know you're kind of stuck in a one place. As a community nurse, there needs to be, I suppose, more avenues for community nurses to progress as a community nurse, because a lot of us are caseload holders within our community setting. But for me, I missed the midwifery and the child and the mother-child development, breastfeeding, and that aspect of what the public health nurses do. And that's why I kind of went on the course, and I'm absolutely loving that bit of learning in the clinics and the support groups, the breastfeeding support groups, child development. We haven't covered it yet, but I have covered it within clinical placement, the CAFNA, and that Helen is going to be doing with us later on in the program. And we're in the middle of doing our community profiling now, which now I suppose when you're out in placement and you're learning about your placement area where you're going to be placed as a student public health nurse, how and why it's so important to know your population, what's there for them, what's not there for them, and what are the needs that are needed in the community, which we're working on at the moment. So
how is the program going for you?
It's grand. It's going. I can't believe time flies when you're having fun. It's daunting initially for anyone who's thinking of embarking on it, anyone who hasn't done any academic writing, and that word research that brings the goose pimples out in all of us. But to be honest, we did that before Christmas, our research module, and it wasn't that bad. There is great support. Lloyd was my mentor in the tutorials, and sure, it's great support. Any questions you had at the tutorials, we had 3 or 4 tutorials, and we all felt that was a big worry, but it was actually okay. There's a method to it, and you just answer what the questions asks you, building it up with research, of course. But it was doable, and I suppose once you get into the academic writing again, anyone can do it. It's just daunting initially to start back into doing the research and logging on and getting your search going and getting the academic writing started. But once you start and have, which you all support us with, the introduction, the main body, the conclusion, and stick to those, and you'll get through them. It's doable. And we're at Christmas, and I know it's a busy 4 months ahead, but I'm sure it'll fly, as everyone says. It's a busy 4 months, but as Lloyd said, late nights and early mornings, all part and parcel of the public health nursing course. And if you don't have late nights, the assignments are too easy, probably. But we all get them done. But it does take late nights, especially when I'm a mother and the kids are around, and you are working late into the night when there's peace and quiet to get the assignments done. But it is doable. Even busy mom of 5 kids, and you know, it is achievable, because once you get started at it and get into that zone of college life, it's very achievable.
So you're out in placement at the moment. So
Yes,
there's a nice variety in terms of you're in for a few weeks, you go
yes,
out on
we
your
are.
clinical placement, so you have a
Yeah,
break from the whole area of
yeah.
academia for a few weeks.
And as you said, this year is the first year of the hybrid, and traveling from Kerry, I suppose it's been, I suppose, a game changer for us. We didn't realize until we landed in Cork on the 2nd of September that it was going to be different this year. We thought we'd be traveling up to 5 days. So Monday was the community service day, which we visited a service in our community that is that one of our clients would use as a service user. And then Monday and Tuesday we were up in Cork. Some days it was 3 days on the Wednesday during the research, or Thursday during the research module. And then it was either we were online Wednesday and Thursday, and then Friday was either self-directed, or we had HSE land, or we had a discussion board that Lloyd or Helen or Mary would give us an article or a report that we would answer such questions on and submit for Fridays. So it's great, the online bit, and the not having to travel the 5 days, because traveling from Kerry, the 4 of us travel together, and you know, it's tiring on the Monday, the Tuesday and the Wednesday. So every day coming home on the Wednesday, we say, how did the girls do it last year, doing it 5 days? So that aspect of it is brilliant.
So that's just to highlight, Katrina, that this year it's, you know, we have a hybrid program
again this year.
whereby we, from the feedback from students from previous
Yeah.
years. So generally what happens now is students attend campus 2 days per week, which is, as you said, is a game changer. It makes a huge difference in terms of quality of life, and also to be able to, you know, to focus more when you're at home in terms of your assignments and your, you know,
Well,
looking
you can
over.
get into it more. You're not arriving home at maybe 6, half 6, 5 days. So you can get, when you're in college, then you do find you're in that academic mode of in the assignments mode. Whereas when you're out in placement, I suppose not the first 4 weeks are observation completely, but you're so, I suppose, blown away by everything you're seeing. It's kind of hard to focus when you come home, which you do focus because you're in that zone of a student learning anyway. But it's different when you're in college. You're more zoned into the books, I suppose, and in that frame of mind when you're attending like school, college as such. But the placement side of it is, we've been, this year this was our first week back out in placement. I know it was difficult and challenging because a lot of clinics and stuff were cancelled, but we did our best learning wise. We were doing a lot in Helen will be delighted with us with our community profiles, and we got a lot of work done for that this week. And but like when you break it down, like you said, after Christmas, 4 weeks out, 3 weeks in UCC, 4 weeks out, and then we're 3 weeks in again, and it brings us up to April just in a heartbeat. And you know, it's a very short space of time, but there is a lot of work to be done in those 4 months.
And the thing, Katrina, is it's a level 9 program.
Absolutely.
I mean, it's a huge achievement to complete a level 9 program. The next level up for that is a PhD. It's a level 9 program, which is the first year of a master's. And the program opens doors for people. It's interesting, with all your experience as an working as a midwife, working as an RGN, working out in the community, and still you say, you know, it's daunting in terms of the community and the learning, but there's still so much learning. How would you say, in terms of the difference between what you've seen now as a PHN student and an RGN?
In the workload?
In the workload, yes.
Well, I suppose a community RGN, for me, having worked in it for 2 years, I suppose I had a bit of a cushioning going into the public health nursing course. It gave me a bit of groundwork on even the charts, the paperwork, the care of the elderly, the different aspects of respite, home help applications, home help, home supports, and different. Now I had watched the public health nurses in Tralee doing their development clinics, etc., but I was never in on one. So I was always eager to learn about that aspect of what they did, and especially the primary visit, which I felt would be very close to what I was doing in the hospital before I left. that to visit the mother when she's just a new mom or even a second or third mom, it doesn't matter, and be able to support her in caring for her newborn baby at home. It's very different. And then I suppose in the hospital, you're confined to the acute setting, and it's a different pace of life. There are long days, 12-hour shifts. Definitely the community, yet you work the 5 days, the 9 to 5, but it's definitely more family life balance as well. That we're all like, you can bring the kids to school and continue on to your day, your working life, and then home a little bit after them, etc., to be there in the evenings for sports, after school activities, all that. So there's a bit of a more of a family life balance.
Good. Yeah, that's interesting, Terry. And finally, Katrina, and thank you so much. You've answered the questions so well. What would you say to somebody who's thinking about applying for the program?
I would say certainly apply. You'll always get support from people in your area, be it Kerry, Galway or Dublin, that have, like myself, embarked on the course. Anyone in Kerry, I'm open to any questions and support to help you with your application. And I know we've discussed this in class as well at the start of the year, that the lengthy process of it. And I know it can be a bit daunting. Those 4 competencies seem, oh my God, what will I put down? But I suppose it's your competencies. A good application is what brings you to the interview, and what's discussed at the interview is your competencies. And just prepare well, do that application, put your heart and soul into it, and prepare well then for your interview. It won't be as daunting if you're well prepped on your competencies and have other examples to back up your competencies. But I would say, yes, it's a very manageable course. Yes, it is hard, I won't lie. It is daunting initially to get into the research and the searching and the IT. And I suppose I'm a little bit older than how many are on our courses that are way better at the computer than some of us. But, you know, I've been on the presentation with Ella, who couldn't join us tonight as well. And, you know, she's young, new, and I suppose brilliant at the computer. Yet we worked very well together at our presentation, and it just shows that, I suppose, the mix in the class, some of us that may be older or younger, it's doable for everybody. And the public health nursing, it's just open to everybody at any age. It doesn't matter how old you are. So it is a great course. Lloyd and Helen and Mary and everyone on the course, very supportive. If you do need any support with any of your assignments, or none of us has needed an extension that I know of, but if we did, Lloyd would be open to that. And look, it's just a great course. A lot of different avenues of the public health nursing as well. There's the immunisation and the school nurses, I've been out with the school nurse, not the immunisations public health nurses yet. But, you know, there's so many different areas within the public health nursing as well, which I'm sure Michelle will touch on as she's working in it more than I'll know about. But great course. I would advise anyone to go and do it.
Thank you. Thanks very much, Katrina. That was very informative. And that leads us nicely to Michelle. So I'm going to ask Michelle a few questions. So this is just all, thanks, Katrina. This is just help you to understand, you know, in terms of what the program entails from a student point of view. And Michelle, you're a past student of the program.
Yes.
So tell me how long you qualified as
I am just coming up on 2.5 years qualified now in public health nursing. Yeah.
Very good. And could you just give us a little flavour as to, I suppose, the role of the public health nurse? What does your daily work entail?
Yeah, so I suppose you'd always hear, you know, like no day is the same in public health nursing, and that's so true. I suppose, you know, we'd go in on any given day and, you know, depending on where you are, be it, you know, country, geographical areas, everything. So your country, your city, and that'll basically kind of dictate your day to a certain extent, depending on, you know, for me, I'm in the country, so my geographical area is quite spread out. So, you know, it takes, like, while if you're in a city base, you might get a lot more calls done because they're all close. In the country, you're definitely kind of, you know, a lot less on any given day. But, you know, it's anything from checking your phone calls to see what you have coming up in the area, to going out doing, you know, I suppose our priorities generally are like blood spots, primary visits and palliative care. After that, you have general wound care, where you go to the homes if they can't come to the dressing clinic, and we have good RGN support as well. a couple of times a week, and they generally run our wound care clinics. And you'd have people coming into the health centre. So you'd have some clients coming in, and you'd have hospital discharges, you'd have follow-up for lots of different reasons. You might get self-referrals where people are struggling at home, and you'll go out and you'll do your assessments and see what the services you can need.
So it's you cover a lot of different areas.
Yeah.
It's very generous.
Yeah.
And what were you doing before you did the PHN program? What area were you working in?
I was working in CUH in neurosurgical nursing.
Neurosurgical. How do you think neurosurgery prepared you for public health nursing?
Yeah, well, I suppose prior to my nursing, I would have worked as a HCSA in the community.
Okay.
So I suppose I would have worked alongside public health nurses, referred into them for different clients. So I suppose that's where all of my transitions rooted from. I suppose the plan was always to go back to community in the long term. Yeah.
Good.
Yeah.
So what actually made you decide to apply for the PHN program? Was it the past experience of working in the community? Was it? So you were on a neurosurgical ward.
Yeah, I suppose, like having that experience, I suppose I always knew that I wanted to go back to community, but certainly wanted experience in the acute setting as well. So I stayed in the CUH. I trained in UCC in general nursing, stayed in the CUH, and worked as a staff nurse there, did CNM1 acting for a year prior to applying for the course. But yeah, definitely, I suppose, when you're traveling to work every day, certainly, I think, going back from shift work and stuff like that was definitely the long-term plan. Moving out of the acute setting, albeit that I got great experience there to bring into the community. But community is where it's all happening now.
And did you enjoy the program?
I did. Yeah. No, it was great. And
did it prepare you for your role as a public health nurse?
Massively. Yeah, massively. I think every module, I'm not a midwife, so I suppose sometimes that daunts people. And definitely, I think, all throughout the course, every module is relevant, albeit, you'd be questioning, God, will I use this? But definitely the transitions, in for theory out to practice is definitely, really good, that you can put that theory and see it in practice. All the modules really, really relevant, and so practical, to what we do, and gives a great base. Yeah.
Did you have good support as you transitioned from a student to a public health nurse, and the beginning of your role as a public health nurse?
Yeah, definitely, massively. And I suppose, in a lot of the times in public health nursing, you'll always come across lone working policy, and that's a really big one. But certainly, like, while you might be daunted by, going out as a qualified registered public health nurse firstly and saying, God, I have a caseload of my own, how will I do this? It's very much, supported throughout, your ADPHN supports you really well. Like every public health nurse out there, you're asking questions every single day. And equally, you see public health nurses qualified with 20 years and they're asking you questions because, we all experience different cases, and, all be those complex cases that you come across, you learn so much from them, and services are ever evolving and ever changing and growing, and it's just always changing. So asking questions every day is a given really in public health. I think, you're always learning and finding new ways of doing things and supporting your clients.
And while you're working by yourself, independently, you're an autonomous practitioner in your role as a PHN, you're working within a primary care centre where you're linking in with other RGNs, and if there are concerns, worries, there's always a assistant director, a colleague at the end of the phone.
Absolutely. Yeah, that's exactly it. Yeah, you're never, without support really, throughout the whole time, like you're working. As I say, experienced public health nurses are asking the same questions as you, and it's quite consoling in the sense that, you know, you're all there to learn, and everyone has a different bit of experience to bring to the table. So yeah, you're never really alone, bar when you know, if you go out to calls or whatever.
So you have no regrets regarding your decision to leave the neurosurgical?
No, definitely. You know, the 9 to 5, it takes a bit of getting used to when you're used to shift, but you know, for the better, really. As Katrina said, it's nice to, you know, have some normality in the mornings besides getting up at 5 o'clock before everybody else. And you're coming home, especially in the summertime, you're driving to work in the bright, you're coming home in the bright, and you know, it's much more functional for families and so on. Yeah.
Good.
Okay.
So what would you say to somebody who is thinking about applying?
Definitely, I suppose if the thought is there at all, you know, you're looking for a change. And certainly, I think, you know, from what I've experienced in the last 2.5 years, the change that's coming into the community is massive. You know, you have so much services now, and everything is trying to move out into the community. So, you know, there's like loads of different options, you know. Even I was saying the other day, I was at a house with a gentleman, and like it's phenomenal. Like he got a chest x-ray done in his home. They came out to the house, they wheeled the x-ray machine into the house, you know. Like these are the changes that we're seeing in the community, like where services that you wouldn't have thought are available, and you know, you're all working as a team, the multidisciplinary team, you know. So you have so many services available to you. So definitely it's, you know, it's a great place to work.
And tell me, in terms of career progression, are there opportunities for you to progress your career as you would, let's say, in an acute hospital setting?
Yeah, absolutely. Like I suppose when people think of ADPHNs, you know, like
That's assistant directors.
Assistant directors, assistant directors, like it's great. And like there are a lot of ADPHNs who support us, you know, in our areas, but equally there are ADPHNs within, you know, disability services. There's the community, the disability network teams. There is, you know, the child health as well, which is a great resource to us. Our ADPHNs there are great within the child health area. So yeah, there's massive, like, you know, you can take any avenue. There's tissue viability nursing, you know, there's lots of different avenues.
Clinical nurse specialities.
Yeah,
there,
clinical nurse
advanced nurse practitioners.
Yeah.
And
absolutely.
of course, as you highlighted, you know, with the healthcare policy, Shlont Care, you know, the focus is to move services out into the community. So that would suggest that there's going to be more opportunities. We're going to have more services in the community. We're going to need more specialists in the community. So with your primary PHN role, you can you can go on to advanced nurse practitioner. You can work as, you know, care teams within the community, manage non-public health nurses as well, like in terms of ICPOP and
absolutely.
other services.
Yeah, the ICPOP is a great service that we use a lot, and like that now there are a few PHNs gone into that role, and they work out at the hub in Ballincollig, and that is just an amazing service to us. You know, we're all working together, and you know, like even within the communities we have CTMs, so it brings together all the disciplines. It's GP led, equally with all physios, speech and language, and we all come together if we have complex cases and we discuss them, and you know, everybody has something to bring to the table. So you know, you just need to pick up a phone or go on to a team meeting, and you know, you can get guidance on what's best to do with any given case. So
it's really a unique role, isn't it? You're going into somebody's home, they're inviting you in, you're caring for them within the circumstances that they're living, and you get to experience, you know, people's situations that you never would in an acute hospital setting. You see things differently. You have to really, really focus on the person holistically. You see their environment, how that is impacting their lives. Huge opportunities for promoting health as well.
Like health promotion is a massive part of our job, and like that now we go into their homes, and I suppose, you know, I have yet to meet anybody that wants to go into a nursing home. You know, they want to be at home. And it might be something as simple as, you know, obviously home health and respite services, stuff like that. But you know, it might be something as simple as, you know, a personal alarm, that might be the make or break to give them security to live at home and live on their own, knowing that they can call somebody for help. And, that's what it's all about. I suppose everybody wants to be at home, and it's where they want to stay for as long as possible. And yeah, accessing the services and, looking at what their needs are and putting in place, and there's great voluntary services out there as well that we use a lot, like Alone and, all the different services that, can bring a lot to the table as well, so.
Yeah, and I know from working as a PHN myself, there's a huge level of satisfaction, because you're the person who's assisting the person to stay in their own home.
Yeah.
All the research says, where do you want to live at home?
Mhm.
Where do you want to die? At home.
Yeah. Yeah.
And we are the ones who are, putting the service, supporting people in order to live. That's extremely satisfying.
Oh, absolutely. Yeah. Yeah. And like when you say, to live at home, die at home, like palliative care, it just means so much to, have that contact and be able to check in conjunction with, like say Marymount, the CNS is there. But, it's great to be able to support them to live and die where they want to at home generally. As I said.
That's fantastic, Michelle. Yeah. Thank you so much.
No problem.
That was really insightful.
Okay.
So what we will do next is I will go to Helen, who's off camera. You can't see her. And Helen is going to, look at some of the questions that were asked.
So there was the question from Eileen. Hi, have you any guidance on completing the competency questions in the application form?
Again, I would suggest that the first thing that I would suggest is you have time now to look at them. I think you need to give it time. And the competencies are related to your own experiences that you have in terms of your nursing. The competencies are to make sure that you're the right fit for what the role of the PHN is. So what I would suggest is that you take your time, work on them, maybe seek a little bit of advice from somebody who has applied for the course previously. That might be something that might be helpful, somebody who was successful obviously in their application. But again, it's like everything else, you have to sit down with it, give it time and to work through it.
There isn't another question at the moment, but I just thought of one while you were talking, Lloyd, just from myself. You mentioned a lot about the content of the course and how it's all organised, but people might be interested to know how are students supported while they're on placement? Can you talk a little bit about preceptorship and how that works?
So the PHN programme has a theory component in with us here at the university, but you also undertake 18 weeks out in the community. 18 weeks is the bones of 4+ months. And during that time, you're allocated a particular area where you're working. In that area, you will have a preceptor who will be with you throughout your placement, supporting you. The preceptor is somebody who is a qualified public health nurse who's completed the preceptorship program here with us in UCC, and you will be with them going into the houses. In terms of support, we have competencies for students to complete, but it's a journey. So nobody expects you to start as a novice and to be an expert. On this program, you move from novice to being competent, to be able to practice as a public health nurse. During that period, you're with your preceptor every day that you're on placement. You're watching them, you're observing them, they're supporting you. As Katrina pointed out, the first 4 weeks, you're only observing. You don't undertake any roles. You don't have to achieve any competencies. But the placement that Katrina's on now, she will start to engage more in terms of hands-on role to achieve those competencies. But her PHN will be there supporting her, watching her, observing her to make sure that she's doing things as per guidelines, protocols, procedures. So it's a process. It's something that, you know, just we don't expect anybody to know it all. They learn as they go. They're supported by their preceptor. And again, everybody works within their scope of practice. So if they're not competent to do something, the preceptor will understand that and will support them in order to be able to achieve it by, first of all, showing them and then by observing them and supporting them.
Thanks, Lloyd. There's a question in from Lucy. If you've worked abroad as a nurse, is that recognised when applying for the course?
Yes. So you just, when you're applying for the program, the only actual experience you have to, when you're applying for the program, you have to submit your academic transcript. You only highlight what you have completed in terms of your work. So if you've worked in Australia, if you've worked in England, if you've worked in Ireland, all that general experience or working as a midwife, all that counts. When you are successful, you will have to show, you will have to get a letter from your previous employer to state that you were working as an RGN for 18 months, 2 years in Australia. So yes, it does count. And yes, you will have to show that, but it does count.
There's a question from Mary. Is question 4 experience relevant to the role to be answered under the format of A, B, C? So I'm not sure if you're tuned in enough on the application form there, Lloyd.
Yeah.
So
in terms of experience, again, I'm not over familiar with the question that's been asked, but again, these questions are specifically designed for you to highlight what you've done and what you're able to do in order to show that that you're able to undertake the program and that you have the relevant qualifications and the relevant experiences. So again, I suppose look at the competencies as an opportunity to highlight what you've done. It's an opportunity to show, yes, I can do this. Look at the experience that I've had. That's a general comment. I'm not familiar with the specific competency that the person is referring to.
Okay. Suzanne has asked, how do you prepare for the interview?
Again, I suppose when I did my interview, I got a book and I looked at, I would have looked at the most common questions that people get asked. I would have also linked in with somebody who did the interview the year before me. But I would have prepared well. I would have done a dummy run with somebody who was working on the community. Perhaps Katrina might be in a better position. Consider the fact it's a while since I prepared for that interview. So Katrina,
the interview is, in preparing for the interview, I suppose, just know your competencies that you have put on your application inside out, and I know you have to give kind of an example of, is it, what's one of them is, providing a quality service, I think is one of the competencies. I'm not too sure now. And then maintaining relationships, say, how you work well with multidisciplinary team, etc., and give an example of how you did that in your working day. And then in the interview, they'll elaborate maybe more on an aspect of what, like there's 4 competencies. So they normally chose 2 of the competencies is what I was asked on in my interview, but you actually obviously don't know which 2 they're going to choose. But just be prepped and ready for all 4 and give another example of the competencies that's requested, like maintaining relationships. Is it, Michelle? I can't remember now. Is it maintaining relationships and
quality and management?
Quality and management would be auditing, etc. Maybe
organizational management.
Organization, how you manage your day, maybe depending on whether you're a community nurse or a midwife or an RGN in a hospital, as opposed to a manager might have more of a managerial role, but it's not that they have one up on you or anything, because everyone manages, because it's not a manager on in a hospital setting every day. So an RGN, a midwife, everybody has organizational skills. And that 4th one, experience relevant to the role that girl was asking about, I suppose it's kind of a little bit of selling yourself in that one, what you've done to date, why you feel you would be good as a PHN, and just selling yourself a bit in that, which sometimes obviously it's hard to do, and you think you're it's not right, but just sell yourself and all your qualities that you have that you feel are relevant for the role of a PHN.
So in terms of experience for the role, a lot of what you're looking at there, now that Katrina mentioned, as transferable skills. So what skills do you have now in your current role that you can transfer into your role as a PHN? So prepare that. Very good point, Katrina. So what you're saying is that the focus of the interview is on the competencies. Prepare by knowing what you wrote, but also a very good point, have another example.
Yeah. Because in mine, they did pull from an example I gave. I think it was the organizational one, but they also questioned on what audits that I participated in, and that what was in my application was an audit, but what other audits had I participated in, and even if some people might be involved in stuff where they're at now or in their previous, like that girl in Australia might have been involved in something in Australia doing an audit. Suppose we audit our practice every day, but we don't really even realize we're auditing it as nurses, but just to have another example to back up your competencies is a big
And the other
one.
thing would be as well to be familiar with the role of the public health nurse.
Yeah, you are sent out in your package for your public health nurse sponsorship in it, and do read, I suppose it's the roles and responsibilities, isn't it, of the public health nursing?
Yeah.
And what you could be asked in any role, what would you bring to that role as your PHN? What do you feel you can bring to the role of the PHN? So you obviously would need to know your role of the PHN. They won't pick all the role of the PHN, but maybe you could zone in on one aspect of the role that you feel you can bring to the role of a PHN. Like you said, transferring it from where you are now to the PHN in the community.
Yeah, and all those skills are transferable. Michelle,
Yeah, I think, you've covered it all. I suppose, scope of practice, code of ethics as well is another one, that they can sometimes cover. But yeah, it's really competency-based interview. So yeah, if you kind of have that knuckle down and, certainly experience, on the experience side, like if you've done any CPDs or external modules, they're always beneficial to mention as well. Yeah.
And as you said, the Sláinte Care, obviously know your policies, and Sláinte Care is a huge one, which is trying to bring everything close to the patient and into the community. So that would be a big one for an interview, and other relevant reports and documents and stuff,
So policies, role of the public health nurse, competencies, plus additional examples. And again, dummy runs, practicing your answers.
Yeah.
And the book to get familiar with common interview questions.
There's a question from Shirley. Is there exams during the course, or all assignments are mixed?
So there's a mixture. As you know, it's a registrable program with NMBI, and as part of that, we need to show that you're competent in all areas of assessment. So you're assessed related to your clinical practice in the clinical placement module. The majority of the modules that you complete, it's an assignment that you would complete. Either a 1,500 word assignment or a 3,000 word assignment. We have one presentation on the program, and we have one exam. The exam is the last module assignment to be completed, and that normally takes place in April. But again, as Katrina has pointed out, Katrina undertook a presentation back in November. A lot of the students were nervous about undertaking the presentation. Students the exam and the presentations tend to be the two things that students get nervous about. You completed that module, Katrina. You saw the preparation that was put in to that presentation in terms from myself as module.
We started off for the first 4 weeks in class, and we were only getting to know each other as a class. And then Lloyd, you did the teams of 2. There was 9 teams of 2. So, and then we were in class, I think, for 2 weeks when you gave us the assignment, and then we were out in placement for 4 weeks. So I didn't see Ella for the 4 weeks. So there was a lot of thank God she's good at computers, I said. A lot of online working and on that one line or Google, whatever it is. And Ella used to set it up and we'd work together on the presentation. And I went up to Cork the night before and we practiced a lot before it, but it was worth it in the end because I suppose it paid off, the presentation, and I did well in it, thank God, both of us. So, but it's just was the practice. And it was daunting when we weren't together and we couldn't meet and we were probably just knew each other for 4 weeks and then next thing we're paired together. But it worked out great, yeah.
But you were prepared well for the actual presentation. And it's the same with the exam. Helen runs the exam module and you do prep as well for that exam. So again, it's a journey you're working towards it. It's a process. So you don't go into anything without, you know, without having adequate support and time to achieve, you know, a pass in the assignment.
So Laura asked, is it a hybrid system to the course in Galway and Dublin also? For example, would it be the 2 days in college each week? Thank you.
Each university delivers their program differently. And I know it's changing, you know, within the UCD and Galway. We at UCC, we have 2 days per week on campus. I think, again, each university, it changes, you know, but I think that in Galway, again, they have a similar system, but they spend more days at the university on campus in person. And Dublin UCD, their program, they had 1 day on campus and 4 days out in clinical placement. So it's each of the universities completely delivers the program a little bit differently. But as Katrina pointed out, I mean, the system now we have in UCC is extremely student friendly. It really, really helps, you know, it really helps you in terms of, you know, quality of life, quality of student life. You're still, you know, there's a lot to be said for being on campus as well. We experienced it, you know, during COVID, what it was like not being on campus. Students were lost in terms that they felt isolated. Even Katrina, you know, preparing your assignments, you're talking to your colleagues, you're meeting them, you're talking to them down the canteen. Like, you need an element of being, you know, on campus.
In UCC,
So, you know, the on campus is really positive. It's, you know, it's fantastic that the situations that we were able to deliver it now on campus for 2 days and have the other way is online or out in the community. So it's really, really student friendly.
And also for people who are daunted about travel, that it's very doable 2 days on campus and you have work to do the other days. But if you were traveling, there are girls in our class even that are traveling from Limerick, isn't it, and West Cork, etc. And you know, it's the 2 days is manageable. I know there's 3 days, I think, in this program coming up for different reasons in the next semester, but it's all very manageable, 2 to 3 days as opposed to 5. So it's great, the hybrid.
And you pointed out again that, you know, you link up with your colleagues and you carpool and
we carpool, you know, we have a WhatsApp group, hopping some days and not other days.
Yeah, excellent. Thanks, Rena.
Okay, Shirley asked, is the placement in the community during college semester or during the midterms and Christmas break too?
So there is a Christmas recess across the university. So the clinical placements run in October for 4 weeks, in January for 4 weeks, at the end of February, and then finally you go back out in the middle of April. So it's not during Christmas while you're on placement.
Okay, it's about 5 questions in there now, so it's really hotting up. So Annette asked, regarding the midwifery placement, is there the same support as public health nurse placement coming from a current RGN without midwifery experience at the moment?
Yeah, the feedback from the students is really, really positive. We run a preceptor program out in the maternity hospital, so they understand where the PHN students are coming from. They have over 25 30 years now. Well, actually, it's 2008. So there's nearly 20 years experience of midwives out in the maternity hospitals meeting PHN students. The feedback is so positive. I've spoken to directors in the maternity hospitals who said that they wish all the students could be public health nursing students, because you're bringing your experience that you have previously in your role, you're qualified, you're transitioning, or you're transferring those skills that you have, that experience that you have. So very fair. The feedback is always positive from the maternity hospitals.
Okay, Deirdre asked, my transcript is in my maiden surname. I'm now using my married surname. Do I need to send in a marriage cert?
No, there's no need to send in a marriage cert. Again, once we can ensure that it is the same person in both of them.
Okay. Katrina has asked, are placements allocated close to where you live? For example, was Katrina's placement in Kerry, and after you complete the course, would you get an area to work in that would suit you?
Okay, so I know the directors of public health nursing well, and each director of public health nursing tries their very best to allocate the student as close to home as possible. So, for example, I've been to North Cork. I was with a DPHN from Dublin, or from Galway, 2 evenings ago. And again, their goal is to make your life as easy as possible. Where possible, they look at the student's address and they try to keep them as close to home as possible. Again, your placement area, the higher you are up in the panel, then the better opportunity you have to get the placement that you want.
And Katrina's asked another question, is PHN nurses' role in the future focusing more on children's health rather than older adults nursing?
Well, as Michelle pointed out, the role of the PHN is changing to meet the service needs. Basically, we're linking in with we are delivering services, and that service need is changing all the time. So potentially right now, the PHN role is a general role, it's a generalist role. You're working from the cradle to the grave. That has huge positives. You're getting to meet all the community. You have the diversity of the populations you're linking with. So that's really positive. But in certain areas, due to high child welfare or very high adult caseload in terms of older adults, the role has been split up, especially it's happening in Dublin a bit, but it's nothing official across all the areas where PHNs are either focusing on child health or they're focusing on adults and older adults.
Mm-hmm.
Suzanne has asked, in the midwifery placement, what areas do you get to work in? Is it ward only or clinics, etc.?
You get to see we try to give people as much experience as possible, while the PHN role is focused on the postnatal period. So obviously you spend a nice bit of time on a postnatal ward, but it's really important for you to see the other areas and the journey that the woman and her family have, throughout their time in the maternity hospital. So you get to work in antenatal wards, you get to work in the neonatal unit, the delivery suite. You get this, they're very good in terms of they try to get the students as much experience across the maternity hospital as possible. But again, the focus is on that postnatal period. So that's where a lot of the time tends to be spent on the maternity placement.
Rosaline asked, how long is the interview?
The interview, I'm not sure.
It seems like an hour, but it's about 15, 20 minutes max.
They give you half an hour altogether, but I couldn't believe it was over. It went so fast.
Yeah, it does.
Florentina has
the interviews. Sorry, the interviews are normally held in the Riverlee Hotel in Western Road in Cork.
Oh yeah, there's 6 different locations for the interviews.
Yeah. Sorry, that would be the Kerry one. Yeah.
Yeah. So the interviews basically are in 6 different areas. Depending on where you live, they will look at your address and they will give you an interview location that's closest to your home.
Okay. Florentina asked, are there specific areas that need public health nurses currently in remote areas outside Dublin, Cork and Galway?
Yes, we cover the whole country. It's only three. The universities are Galway, Dublin, and Cork, but we have students from Limerick, from Kerry, from Waterford. We have students in Tipperary, Limerick. Galway have students up in Donegal. So there are vacancies all over the country. We have 160 sponsorship places for this year. So, and they're covering vacancies across the country.
MC asked, do all public health nurses work the same hours, for example, 9 to 5? Is there flexibility with start and finish times? Also, public health nurses required to provide on-call cover over the weekend, for example. Thanks.
The
37, yeah, 37.5 hour week is our working week. Start and finish times, really, to be honest, you'd have to maybe discuss with your ADPHN at the time. Generally it is 9 to 5. And what was the other part of that question?
Weekends.
Weekends.
Yeah, weekend.
Again, that depends on the area as well.
But you don't have to work weekends, do you? Or
I think the contracts that we're signing now are 7/7 going forward. So it depends on the areas. Some areas wouldn't have PHN cover at weekend service. They would, maybe have RGN cover only. So it depends on the area. Yeah.
Okay, Suzanne, I have my transcripts for my degree. I also have a postgrad completed in public health promotion. Do I need transcripts for this also?
no, your degree is more than sufficient. It's level 8, provided it's a level 8 degree. Just one transcript, level 8 is perfectly fine.
Roisin asks, I live in Donegal. Would that mean I have to travel for the classes twice a week?
To Cork, if there's in-class sessions, yes, you would have to attend those in-class sessions. And we've had several students from Donegal.
In Donegal are here, so
Airbnb or
5 days a week.
Yeah, they were traveling.
We had no hybrid.
My God, they were traveling 5 days. So it's we get students from all over the country. But if there's an in-class session, then you absolutely need to attend that.
Deirdre asked, I'm an RGN RM, but only have certificates in both. However, I did complete a level 9 12-week module in UL last year. Will that module alone suffice for educational requirements, or will I still need to complete an APEL or less? Well,
if is it Deirdre?
Deirdre, yeah.
Yeah, Deirdre, if Deirdre's a registered midwife, she would have if she did the postgrad program, that should be more than sufficient.
Well, no, she said she has certs in both, so maybe she did them a while ago.
Okay, so again, the level 9, it depends what the program was.
It was 12 weeks, so I suppose how many credits does she have?
Yeah. So if that's a 10 credit module,
9 credit maybe.
No,
a level 9.
Or level 9, but 10. So if it's a 10 credit.
Oh, sorry.
If it's a 10 credit level 9 module, and if you have a transcript for it, yes, that is sufficient. So just to repeat that again, if it's level 9, as you've stated, if it's 10 credits, ECT credits, you'll see that on your thing, then that will be sufficient to show that you've relevant qualification at that level. Yes.
Faith has asked, are single qualified midwives able to apply for the PHN role? Sorry, I was late. I must have missed it.
You need to be a registered general nurse to apply. So if you're not a registered general nurse with NBI, or that you can be registered, then unfortunately, if you're a standalone midwife, if you have a ID qualification, so on and so forth, it's midwives, or if you're an ID nurse, or if you're a psychiatric nurse and a mental health nurse, if you don't have a general RGN, a general nursing qualification, then you can't apply for the program.
Kira asks, how does the sponsorship work? I work full-time 5 days a week, so I'm guessing that I would have to give up my job to undertake these studies.
Yeah, it's a full-time program. you would give up your current role. You sign a contract with the HSC, and the sponsorship program is fully funded. So you receive a salary, which is the only program in the university that you receive a salary, and the salary is the wage of a first year the first staff nurse level on the scale, which I believe works out at somewhere around 40,000.
Florentina just asked again, in relation to transcripts, does anyone look at the marks, or they don't matter as long as the level 9 diploma is completed?
Yeah, once it's completed, once you pass this, the actual mark that you get isn't relevant. Once you have passed that level 9 program and you have an academic transcript to prove that.
Chloe has asked, does sponsorship mean that the cost of the course is covered for you?
The cost of the course is covered, is paid by the HSC, and you also, as I highlighted, you have a salary as well. And at the end of it, you have a job as a public health nurse. So when you sign your contract, you are guaranteed that you will be allocated an area within your sponsorship area, and you will work as a PHN. So you get the program paid for, you have a salary, and you also end up working as a public health nurse.
Laura asked, will this PHN sponsorship course be running over the next couple of years if this year would not be possible due to personal circumstances? Thank you.
Well, from Helen's and my point of view, we hope so. As we said, there's more than ever a need now for community-based services. The role of the PHN is expanding, in terms of, we're taking on more roles. It's becoming more complex. So I would very, very much so hope that we will be running this program over the next few years. The PHN program, we're 30 years this year as a university. Not as a university, as a school, and the first program was the public health nursing program. So we've 30 years down, and we hope to get at least 30 more.
And Cleena has asked, are all interviews in person? I'm currently abroad and planning on moving home in the summer.
Yeah, that's a great question, and I was going to highlight that when somebody asked me. So the interviews are in person. If you can't make it in person, an online interview can be arranged, but you have to make the HSE aware that you're unable to attend in person, and they will schedule an online interview for you, which is fantastic. So you can go online. So do apply, and you can undertake your interview online.
Natalie has asked, I'm working with the HSC for 20 years. Am I breaking service if I apply for the course?
No, your contract still is per the HSC.
Deirdre asks, hi, I've only received 9 credits for the 12-week level 9 module. So this was the question earlier. So does that mean, seeing as it's not 10 credits, that I will still need to complete an APEL?
No, like 9 credits is kind of unusual. I need to see the transcript, but even if again, I'd need to see the transcript. If you want to email me, go on to the UCC website, email me, send me on the transcript, and I can look at it. Absolutely no problem. It's hard to say. Like, Helen, what would you say? It's hard.
Yeah, I've when the standalone modules first started coming in, I was screening at that point, and I suppose some of them were even 5 credits at that stage. But again, I wouldn't have been screening like you have, Lloyd, for the last number of years. So I mean, you can make a call, I suppose, once you see something.
Yeah, once I see it, I will know. So please don't hesitate to email me the transcript. I will look at it, and reply. It sounds very much so like it would cover what you need in terms of academic qualifications. So I'd be positive about that, but I'd have to see it before I'd confirm.
So I've been ticking off as people ask the questions. So I've just had a quick check. We've gone through about nearly 40 questions that I could see. So I don't think I've missed any, and there's no new posts at the moment. So we've certainly dealt with a lot of questions there.
Yeah, and I hope that the questions and answer session was helpful, because I mean we've covered the details regarding the program. We've had thanks to Michelle, and I have to really, really thank Michelle and Katrina and Helen, of course. But, this is, we've covered a lot tonight. And I hope that you got the answers and the information that you were looking for, that you came online to get. Again, if you haven't, if you still have queries, if you still have questions, my email is available on the PowerPoint presentation that will be available to you. So you will be able to email me directly with any other queries.
Annette just asked, once we're qualified as a public health nurse, do we stay in the area we're allocated to work in?
18 months service once you're qualified in the area that you're working. So say, for instance, I'm in Southley, even though I'm from West Cork, but Southley, and yes, you do 18 months and then you're free to go on a transfer panel to the area of your choice.
So some people want to stay and they want the security of staying, and that you stay in you absolutely stay in the area. However, if you want to move, you have to do 18 months and then you move thereafter.
Yeah, look for it.
And last question, Helen.
Elizabeth, hello. Question from someone who would still be on maternity leave in September 2024. Maybe you meant 25, and has applied for unpaid maternity leave up until April 24. I presume you mean 25 again. Would this be an issue in terms of being paid, as this possesses a concern for me?
Well, when if you are successful, you need to sign a contract with the HSC. So it's a whole new way of working compared to your old contract. You would be the same as anybody else. You would sign the contract, you would undertake the program, so you would receive the salary, you need to attend all the programs. Perhaps if you have, if you are out on maternity leave, perhaps it might be better, to wait until the following year, but that's a call you have to make yourself.
And I think the last question, how can one go about recognition of prior learning programs? Would this be done during the program or before the program?
So again, in terms of exemptions from modules, the public health nursing program is the only exemption that we have on the PHN program is for those who are midwives, and they're qualified midwives. They do not need to undertake the maternal and child health, maternal, infant and family health module. Katrina is a midwife. She didn't have to undertake that module. Michelle isn't. Michelle did have to undertake the module. So the only exemption in relation to prior learning is the maternal, infant and family health module. Okay, we're going to close the session. I want to thank Tony as well, our AV guy here, who's been very, very supportive to us here over the last few hours. So thank you, Tony. Thanks to Helen. Thanks to Michelle. Thanks, Katrina. And thank you for joining me and team here at UCC. We look forward to seeing you hopefully come September. Take care.
Bye.
Bye. Good luck.
Bye.
Bye.
Thank you. Bye.